Millions of dollars literally at stake and millions of lives on the line. The debate over health care reform is highly charged, and we have seen that play out for months now. Now, one doctor is going up against the most powerful medical organization in the country. That's the AMA, the American Medical Association. She is a woman's health expert who has cut her ties with the AMA because of his position on the White House health care reform plans. Dr. Elizabeth Vliet says the AMA has sold out doctors and patients, and she's here live out of Tucson, Arizona to explain her position. Good morning to you. You're all fired up about this. How come?
I really am, Bill. I think, patients say to me every day, why isn't the AMA doing something about this? We're afraid that we're losing our choices, we're losing our private health insurance, it's invading our privacy and our freedom, and they don't realize that the AMA doesn't seem to represent patients or doctors anymore. 85% of their revenue comes from non-membership sources. They are in the business of medicine, and I really thought when I joined, I joined in 1979, just after I graduated from medical school, because I felt this was the gold standard of the ethics of the practice of medicine. And I have been very disappointed as I've watched the progression of my professional organization over the years. And this is the final straw. I really think they are selling out patients and doctors mainly to keep a business line going.
Well, that is a strong
really
claim. Let me just stop there. I can sense your anger, and I want to tap into that to get a better understanding for me and our viewers at home. How is the AMA not serving patients?
Well, when you look at the fact that the House bill is mandating or requiring counseling every few years, every 5 years, I believe the number is, for people over 65 who are sick to discuss end of life. When you see that the government is intruding in the physician-patient relationship, that violates the AMA's own statement on their website that under the managed care advocacy platform, they want to fight third-party interference in the doctor-patient relationship. And I think it's a good example that under their endorsement of the Washington health plan with the government takeover, these government mandates, the requirement that there can be no private plans after this public plan goes into effect, all of that violates the very principles that the AMA puts on its website and represents to us physicians and to patients that it stands for.
We found this on the website. James Robock's the president of the AMA. We can put this on the screen. Part of his statement, and it's a long one too. This is the last sentence in this statement. The AMA is fighting for patients and for the medical profession with principles of pluralism, freedom of choice, freedom of practice, and affordable quality health insurance coverage for all. What you're saying is exactly the opposite. You're saying the AMA is out for itself in the healthcare business, in the business of business to make money.
I think the evidence would suggest that. Their 15% of their $280 million annual revenues is all that they get from members. They only represent approximately 17% of practicing physicians, according to the December 2008 numbers. If you look at the numbers from December 2008, 20% of the AMA members were medical students, 13% were residents. Of the roughly 256,000 members, that leaves 157,000 practicing physicians out of 900,000 eligible physicians around the country. That translates, if you do the math, to 17%. So obviously there are a lot of physicians whose voice is not represented by the AMA and who feel strongly that our duty under the Hippocratic Oath and under our ethics in medicine is to the patients, to the patients and their benefit.
About a third of the doctors in the country are even members of the AMA. Our own doctor here, Mark Siegel, has a piece today in the New York Post which pretty much echoes a lot of what you're saying. And you can tell that all the sides are lining up right now, including your own. And we got the statement from the AMA, but after 30 years, you're saying goodbye. Dr. Vliet, thank you for coming and explaining yourself today.
Thank you very much for having me.
18 minutes past the hour now. More views throughout the morning. Megan?